My name is Rosie Moore, and I'm here with my husband, Marcus Moore.
She texted me at my job with the pregnancy results, and I was like just blown away, excited. I'm going to be a father. I couldn't believe it. I was thanking God. I was just very happy and elated about it, and because we had we had been trying for quite a while, and but we just left it in the Lord's hands, and along came the baby with the pregnancy.
I started care with the doctor, of course, immediately, and then about 2-3 months into the pregnancy, I started having some complications. The things that the doctors were telling me when I went into the hospital the first time, he was all of probably 19-20 weeks old, and the doctor said he's not viable, he won't make it if we have to deliver, but your health is more important because you are at stroke level. Then the second admission, he was about 21 weeks or so, and again they said we can try and take care of him, but the chances that he would live, I mean, the stuff that the doctors were saying was very scary. All the things, his life would not be normal. Dr. Jackson, my OB, recommended that I have a high-risk ultrasound. He found a different problem. In addition to my blood pressure, I had a reverse flow in the umbilical cord. That was a different complication. The more that my blood pressure went up, it seemed that the better the baby was because it would push the blood volume to him, but it was a danger to me. And the more controlled my blood pressure, then the less blood that he was receiving with food and nutrients. So the body was causing a terrible reverse flow, which he said we will have to take him earlier because of the fact that he can have intrauterine growth retardation and a bunch of other medical problems. The one night that I told Mark, go home, nothing's happening, we're just hanging out here waiting. And I called him and he was on his way to work, and I said they're taking the baby now because they can't find his heart rate, and they found his heart rate and he had decelerations or whatever. It wasn't normal. He was struggling, and within minutes they did the C-section. They put me out. I don't remember much of anything. The next 2 days were a blur. I really didn't see him for 2 days, except a picture that a nurse took and sent it with Marcus, and that was the first time I ever saw him on picture.
She eventually did get to see the baby as she came out of it, and we just worked through it moment by moment.
And when I first saw him and saw the machines and saw the babies there, my knees went weak because I had never seen something like that in my entire life. My son there, fighting for his life with a million tubes there. It seemed like his whole body was covered with wires and tubes and monitors and things beeping and liquids, and I didn't know what to do. Even though I didn't have to do anything at that time, but they were telling me, this is what this tube is for, this is what's helping him to do this, and they explained everything. And a part of me wanted to know because the curiosity of being a nurse, but at that time I wore my mom hat, and it was more, when is he coming home? That was the question I asked all the time, when is he coming home? And little did I know the recovery would be very, very long. But the team of nurses,
Of course, Janice was the primary, and she really encouraged us a lot, and that everything's going to be okay with the baby, and just described all the processes that babies in the NICU go through. But we just adjusted from day to day. Things got better as time went on, but the nurses always made us feel comfortable. They always educated us on the things we needed to hear. Sometimes things that we didn't want to hear, but things that we needed to know about the baby, and just in terms of, the reality. And that's what it is. When you have a baby in the NICU, it's a dangerous place for the baby to be medically, and there's some babies that don't make it. and we had to be aware of that, and we had to deal with that reality every time we came to the NICU. But we trusted God, and we prayed every night for Kaleb before we went home, and we just believed that everything was going to be fine. So, but the nurses were always great, and they really made all the difference, because there's certain stages where we were, just going through that difficult time as parents, and the right nurse would be there to say the right things to us to really help us. I can't remember all the names. There were so many of them, but I, of course, remember Janice. There one particular nurse her name was Deidre, and she was one of the ones that would help the lungs, to clean him out when he was desatting, and she was just a real encouragement. She had shared, her faith in God, and that she believed that, everything was going to be fine with the baby. And so, the nurse, without the nurses, obviously, we would not have made it through the process. You agree?
Yeah. Hey, Tina McFarland, I did not have any idea, probably until maybe 2-3 months, or maybe I had talked to her on the phone, but I had not really met her because she worked in the evenings, and most of the time we left before the evening shift started. And one night we came in and we met her, and I did not realize she was Kaleb's primary nurse at night. And she sat down with us and said, "Do you know that your son loves to hear me sing songs about Jesus?" And I looked at her, and knowing that this is a Christian hospital, of course I was okay with that because I am a Christian myself. But to know that when I went home, he was cared for by someone as if it was me, and someone that spoke to him of the Lord and sang songs to him, was a big comfort to me. And during the day, Carrie Livingston would take over where she left off whenever she was scheduled to work. And to know that these two women would take care of him as if they were his mom made my life a lot easier when I wasn't home, because I couldn't stay here. I couldn't drive for almost, 12 weeks or so? Mm-hmm. I was not allowed to drive because of the C-section. So I had to wait for a ride from Marcus whenever he'd get off from work. And it was very frustrating to sit at home and just wait and wait for someone to bring me here. But the comfort of knowing that these ladies were taking care of him made it a lot easier. We got the word that he was going home. Tina, that nice nurse that I talk about in the evening, she came in early that morning and gave Kaleb a bath and had him changed in his going home outfit and sang to him. And a couple of the other nurses came in even on their day off to say goodbye, because he had endeared himself so much to everyone after being here for 5 months. And Marcus took everything home, equipment, everything that the hospital ordered for us. And the only thing I can remember is waiting downstairs where the valet is. He went to go get the car. I was sitting there holding the baby with his oxygen. I was in the wheelchair because it's the way they discharge you from here. And I just kept looking back over my shoulder thinking, is someone going to take him and say, no, he can't go home? That was my biggest fear. And I left and I didn't look back. Not that I didn't like being here, but I just lived here for so long, I wanted to just not come back. I did come back last December to visit, and it was pretty tough, but I needed to come back just to have closure that this is where he was born, and he's just a miracle.
Kiss. You go like this. Put it on for here. Give it to Janice. Give it to her. There you go. You want to see my badge again? Are you swimming with